Good morning, and thank you for joining us for our last presentation of our virtual Newborn Expo. I have joining me Dr. Kelly McCarthy. He's one of our board-certified pediatricians here at Boys Town Pediatrics, and we're excited to bring well-care visits in a pandemic. I have some questions that I'm going to ask Dr. McCarthy, and if you have any that you want to ask during the presentation, go ahead and put those in our chat box below, or private message us anything that you feel is more personal. So the first question that I have, Dr. McCarthy, is what exactly is a well-care visit?
So a well-care visit, or a well-child check as we call them, is an opportunity for you to bring your child into the pediatrician's office, where we give them kind of a once-over from top to bottom, and we answer any questions that you have. We evaluate growth and development, and then we provide vaccines and preventative health guidance. So it's basically all the things that you can do and discuss to make sure your child's healthy.
Okay, and how can I go about scheduling those appointments? Can I come into the doctor's office right now?
Absolutely. So we're still scheduling well-child checks. There have been a few different changes to most of our schedules. Most of the pediatrician schedules have altered a little bit in that we're trying to make sure we keep all of our well checks grouped together during different times of the day, so that families feel safe and comfortable to come into the doctor's office. But certainly we're encouraging you to call our clinics, call our offices, and make your well-child check appointments.
Okay, and if I wanted to make a virtual appointment, is that possible?
Virtual appointments are possible. For well-child checks, we're encouraging in person though to come in, because that's really the best way that we can check things like height and length and head circumference, and make sure, and then obviously to give vaccines. So we're encouraging well-child checks to be in person. There are, for other complaints or concerns or things, virtual visits or telehealth medicine visits are still possible though.
Okay. And a lot of our viewers probably do not have a pediatrician established yet. Mm-hmm. So how do they go about establishing a pediatrician and knowing what to look for in a pediatrician?
So I think a lot of it is just who you feel comfortable with, and everyone's going to have their own personal preferences on that. So word of mouth is one way, getting online, looking at people's profiles and things that we have online at Boys Town. You can learn about our pediatricians there. And then coming in for what we call a meet and greet with the pediatrician is always a good thing to do. So you can schedule that with Boys Town, come in where it's a visit where you just sit down and get to know pediatricians, and you're free to do that so that you feel comfortable with the doctor that you choose.
Okay, and I believe those are virtual also.
We can do those in person as well though. If
okay.
You'd like to come in for that in person, that's perfectly fine to do that.
Perfect. We get a lot of questions about how many people are allowed to come into the appointment. Is it just one parent?
Right. So our policy currently is one healthy adult can come in with the child for their visit. Now, exceptions can be made to that depending on the needs of the family. Sometimes that's just not a feasible thing. They have to, bring another child. There's just no other way to do it. We do make exceptions to that, but that's going to be on a case-by-case basis. So right now we're just recommending one healthy adult to come in with the patient for the day. But obviously you can explain to the nursing or scheduling if there's going to be any other needs that you would need to have, but you just have to let us know and we have to work with you on that.
Okay. And do you prefer the patients to come in with a mask, or are the clinics providing them?
So our hospital has a 100% masking policy where all the doctors, nurses, and staff are going to be masked, and then we're asking adults and kids that are able to keep masks on to have masks on as well, just for the safety and security of everyone.
Okay. And infants, my baby, should I bring?
Infants probably get exempted from that.
Okay.
It's just not feasible for an infant to keep a mask on their face. So yeah, they would probably be exempt from that.
Okay. Do the clinics have toys or books that my other kids can play with, or are those not available at this time?
Pretty much not available at this time.
Okay.
Our waiting rooms have been pretty cleaned out, and we have sick and we have well kind of waiting areas, although we're trying to really separate our appointment times such that, if there's people that are coming in with respiratory complaints or kind of cold-like symptoms, things like that, we're keeping those to like end of the day, at least at our office downtown, so that well checks are really kind of coming in all at the same time. So we're trying to kind of divide and separate patients a little bit from that standpoint.
Okay. Is it possible to get the coronavirus from visiting a clinic or a hospital?
I would say theoretically it would be possible. I would say in reality and practically that is very unlikely to happen. And because of all the procedures and policies that we put in place to make sure that you're healthy and safe, I would say the risk of not coming into a well child check would be greater than the risk of getting coronavirus from coming into that check. So I would say it'd be better for your child, much better for your child to come in, get their checkups, make sure they're healthy, make sure they got all the vaccines they need, than any risk you would have from coming in and contracting an infection.
Okay. And do you know what some of the OBGYN clinics are doing as far as delivery? Are they allowing spouses or significant others in the delivery rooms?
So I think every hospital is going to have individual policies on that, but I know visitors are at least one visitor is allowed per room per patient. So there shouldn't be anyone delivering alone. I think at this time during the pandemic, I don't think that's happening anymore. I think everyone's pretty much allowed to have a visitor of some sort.
Okay.
Or support person.
Probably important for them just to call and check ahead or
definitely
ask.
Check with your hospital with their policies before you make any arrangements there.
Okay. So for individuals that may have missed some well care checks at the beginning of the pandemic, was it okay to skip those?
I think now is a great time to start catching back up on that stuff. If you've been away from the doctor for a while, you've been nervous to go out, and I think now is the opportune time to begin rescheduling those things, getting things back on the calendar, so the kids aren't falling behind on things. I think our hospital's doing a great job of making sure families are safe, that we're doing all the precautions from sanitizing surfaces to the masking to making sure families are safe when they come in.
Perfect. So just some questions about when is the right time to allow visitors into our home to visit baby, and can they cuddle, can they kiss, an infant?
Right. So that's a tough question. It's going to be a person-to-person, decision what they want. I will give some guidance there on that. I would say, I think staying away from large groups is always a good idea. If ever you're going to have people around the newborn, you don't want to have the baby in probably large groups of people. That's just for anyone. I think that's probably something we want to avoid at this time. Also, anyone that you're going to have around the baby, you're going to want to make sure that they're healthy. That they haven't had any respiratory symptoms, they're not coughing, they've not had any fevers, anything like that. You don't want sick people coming around your newborn. I think most people would agree that that's pretty common sense, and we'd recommend that at any time, whether we're in a pandemic season or not. The third thing is just good hygiene, hand washing. If anyone's going to be holding the baby, have them put a little hand sanitizer on. I think most people in this day and age, they're going to realize that they're not going to be offended by that. In this day and age, we're just asking people to kind of hand sanitize, be clean, so that everyone's healthy. And then this could be a little bit up to the person, but I think it's okay to ask that person to wear a mask if they're going to be holding your child. I think that's perfectly fine to do that, and wouldn't be overstepping your bounds as a parent. So yeah, that would be my general recommendations. Trying to avoid large crowds, hand washing, and just maintaining those normal good hygienic practices when visiting with family and friends.
Okay. So we don't hear about a lot of cases of infants contracting COVID-19, but is it possible, and is it possible for COVID to be spread from mother to the fetus? So
coronavirus is a respiratory tract infection, so think of like the flu or the common cold or things like that. So that stuff can obviously spread to The risk is going to depend on the exposure and exactly if someone's symptomatic or not symptomatic. But it is possible to spread to an infant. Now, infants are not thought at this time to be at any higher risk than any other child, or that the risk isn't greater than any other respiratory illness that an infant could contract during any other respiratory symptom at this time with the data that we have.
Okay. And what are the symptoms that I should look for?
So I think fever, cough, respiratory distress, nasal congestion. Those are the respiratory symptoms that we're looking for. Would be the same in an infant that we would see in older children or adults. And then the temperature of a fever, we would consider a fever would be 100.4 or greater.
Okay. So, there may be some mothers out there that are experiencing some anxiety or, just some stress that's caused from, knowing, that baby's on the way, but also from the pandemic. Can you give any pointers for dealing with that?
Yeah, I think the world that we live in now is fraught with anxiety and with different challenges that we're all facing, whether economic or medical or whatever they be. I think there's a lot of people suffering with anxiety at this point, and concern and worry. I would say a couple of different things, especially postpartum, when we know that the moms are going through major transitions and having a hard time. Is making sure that you're getting the rest that you need. I think sleep deprivation adds to all of those things, especially when babies are up a lot. At night you're breastfeeding, your routine, you're just building that routine of having a new baby. Resting when you can, taking naps when you can, is going to be very very helpful for you. If you have a loved one at home with you that can hold the baby for a little while, a spouse, or another family member, to give you a break, can help you at nighttime, bringing the baby to breastfeed, or can change a diaper for you. I think all of that is it's good recommendation, I think, anytime, but especially in this time right now. I think fresh air is good for you. I think stepping outside the house, not necessarily going to groups or anything, but getting some fresh air, going for a walk, doing that kind of stuff, at least in the morning or when the weather is suitable for that. I think that's really important. And then just being self-aware, knowing that, okay, I'm getting a little worked up, or I need to be aware of how I'm feeling, and seek help if you need to. Those are just a few little pointers that can help during this time, but those are some things I think that are good no matter what situation you're in.
Okay. And you touched on a little bit of seeking help. Is that something, if I think that, if some of our community moms think that it's more than just a little bit of anxiety or stress, mm-hmm. and maybe it's more on the postpartum, mm-hmm. Side, can they talk to their pediatrician about that?
Absolutely. And when you come in for your well child or the early out newborn exams, we try to ask moms, how they're doing, how they're feeling, how their moods are, to make sure that you're doing okay. And we have different people here, support people that can help you if you're looking to get established with someone to help with mental health concerns. We can do that as well.
Okay, wonderful. Should I be concerned with my child if they're missing some of the common milestones like walking, crawling, potty training? Should I be concerned with some of those things because of the pandemic?
I think kids frequently take the lead from their parents. So if I don't foresee the pandemic necessarily affecting growth and development as much, as long as parents are still doing all the other things that they would normally do with kids. You're reading to your child, you're playing with your child, you're talking and interacting with your child. You're doing all the things that normal parents would do. I don't think the pandemic should stop kids from developing or growing meeting the milestones that they normally would. There could be some additional challenges because of that, and it might take some creativity on the parent's side to continue to do things and help their kids grow and develop like they normally would. But I don't think the pandemic should halt that. Now certainly if there's certain behavioral concerns, anxieties, different things, Boys Town, and our pediatricians and our behavioral health specialists are certainly available to help you talk through some of those things and walk you through some of those things. But I don't think this should inhibit any child's growth and development. Hopefully, that would be our goal at least.
Okay. And the pediatrician would help with, talking through some of those concerns and knowing
Absolutely.
if a behavioral health.
Mm-hmm. Absolutely, and then making referrals as needed, phone calls as needed to get you set up with the right person that you would need.
Okay, great. We have a lot of concerns too from parents with kids going back to school or sending kids back to daycare now that things are starting to open back up. Are those places safe?
Yeah, I think our government's all kind of, and our leadership are all kind of trying to wrestle with that question right now. And I think we also have to think about it just as a big picture. Certainly our concerns about our kids getting infected and getting sick and those kind of things. But we also have to remember that all the benefits that kids get from going to school. So their education, the social interaction, their for some kids it's going to be getting meals and different therapies and things that they get through their school. So not having school and not going to school also carries several risks too. So I would encourage parents to kind of think about it from that standpoint as well, knowing that going to school is always going to carry some risk. We're always going to have some risk from being out in groups and things like that. But I think our schools are really working hard to make sure kids are safe through all the different policies that they're trying to institute, to make sure kids are healthy and able to grow and able to learn in the best way possible.
Good. And I'm sure kids are missing their friends and being in that environment.
Yeah, and that socialization is really important.
Yeah. What about with summertime school, swimming pools and parks, playgrounds?
So we're still recommending social distancing. So social distancing, keeping 6 feet apart if you're unmasked is still the general recommendation from leadership, from CDC, from things like that. And if kids are going to be playing together, we're asking them to mask. That's not always feasible. I would say, generally speaking, avoiding large crowds is always going to be, I think, a solid recommendation. I think a lot of the other recommendations are going to be very much on a personal basis, family to family kind of basis, what they feel comfortable with and don't feel comfortable with. But staying away from large crowds, staying away from people that are sick or know that have been exposed to the infection, to the coronavirus, I think are just practical means that you can do that. And obviously, good hand washing, masking where you can, just all the other things that we're recommending during this time are important to consider whenever we think about going out and being around other folks.
Okay. I'd like to touch a little bit on vaccines, and I know we're hoping that there's a vaccine for COVID-19, and if that comes down the pipe, and when that comes down the pipe, will there be a vaccine, do you think, for infants, or will it just be for adults and children?
Right. I mean, that's a good question. My blunt statement will be, I don't know. But I think the goal will always be to get as many people vaccinated as possible. So how that gets rolled out, and it all depends on who the vaccine's kind of been tested on. And if it's been tested only on adults, then maybe it starts just with adults, and then, or it gets rolled out with healthcare workers and people of high risk. And so there's going to be some when the vaccine, or hopefully a vaccine does come, there's going to be kind of probably a staged approach to how the vaccine is used. But we'll just have to kind of wait and see a little bit on that.
Okay. And with fall, coming up here soon, parents that normally would get a flu shot in the fall, will that kind of still stay in effect, or?
Definitely going to be very important to get your flu vaccine this fall. We don't know how things are going to go necessarily in the fall, when our flu season is going to hit, but definitely encourage folks to get their flu vaccine. It's going to be really important this fall to do that.
Okay. And do you have a website, or do you have any recommendations on where to go to get the latest information on the changes with COVID, since it changes every day?
Changes every day. The Department of Health and Human Services for the state of Nebraska has a really good website that keeps you up to date on the latest recommendations from our state. And then nationally, the CDC is who we refer a lot of people to go to that website. Tons and tons of information there that you can get information, 24 hours a day, 7 days a week. And then, of course, don't feel free to call us and talk through if you have any questions. Just give our office a call, and we'll be happy to answer those questions as we can.
Perfect. I don't think I have any other questions. Hopefully we've gotten some questions that are coming in through the chat box and through our personal messages. But thank you, Dr. McCarthy, for joining us this morning. This was very informational, a lot of information that I hope our parents can take away and use as they're starting this journey to parenthood. So thank you again, and thank you to everyone that joined us this morning, and good luck with bringing your child in to our world. And we're here at Boys Town Pediatrics should you need anything.